Welcome to this episode of Doctor-Patient Conversations. Today's topic is autism. We don't hear about it much, but it is prevalent and comes in very early among our children. But we often ignore because we do not know the signs, we do not know the therapies, and feel ashamed, even guilty at times, and hence we hide this, resulting in trauma to our young child as they grow up. I bring you questions from patients for Patient Safety Foundation as a mother and as a parent. And to answer them, we have an expert, Ms. Saloni Razdan, who has 20 years experience in this field of autism spectrum with therapies that she has personally practiced in schools, at home, and runs her own clinic. We welcome you to this episode brought by CAHO and PFPSF.
Thank you so much, Nadira ma'am, for inviting me. It's an absolute privilege to be here and share this space with you. Thank you.
Our very first question, therefore, is what is the meaning of autism? What does it mean? What are the early signs? How do I detect it? And can it be prevented?
So autism spectrum disorder is a neurodevelopmental condition that affects how a person perceives his world and interacts with his world. Autism, or ASD as we call it sometimes, typically begins before the age of 3 years. Symptoms usually start showing around 12 to 18 months of life typically. Sometimes they don't show at that age, they may show later on at about 24 months. Sometimes it's also a little puzzling for parents because children develop and meet all their developmental milestones till about 18, 24 months, and then they stop gaining new skills, or they will lose the skills that they have previously gained, what we call regress. So that's typically the period where parents will red flag certain things and think of going to a doctor to see their child. Diagnostic criteria across for autism spectrum disorder is primarily on two main characteristics. One is social communication and interaction, which basically talks about how does the child communicate and interact with his environment. Does babbling start coming? Is language delayed? Around the 9 months age, is he beginning to respond to people calling his name, or does he have eye contact? What is the use of facial expressions that the child is using? Is he noticing people coming into the room and playing with him or interacting with him? Or mostly what we see is children having difficulty with the reciprocity or the back and forth exchange, whether it comes to conversation or it comes to play. And those are the characteristics that we're looking out for when we're looking at diagnosing children with autism. That's the social communication and interaction characteristic. The second criteria is your restrictive, repetitive movements or behaviors, also known as stereotypical behaviors, which basically means a lot of our children with autism will engage in the same movements or the same patterns of behavior repeatedly. So they will either, you'll see a lot of rocking sort of movements, you'll see finger flicking, they may be tapping their body parts or surfaces like the table and things. Obsessions or really being extremely passionate about letters, numbers, colors. We've started seeing that a lot recently as well. Play can look very basic in the sense that they want to do the same thing over and over and again. And when you try to intervene to maybe change the way they're playing, you may be faced with a little bit of resistance, perhaps a meltdown as well. Another thing that we see with children with autism in this characteristic is what we call hyper or hyposensitivity to sensory stimuli, which basically means that things like light, sound, smells, textures that may be absolutely tolerable and okay for you and me, these children have very extreme or extremely subdued ways of responding to those stimuli. So we see a lot of those kind of characteristics in the early ages of children.
I mean, is it reversible, or is it comes and goes, or is it comes and stays? I mean, is it a family thing, or did I cause it? Why does it happen? Who gets it? What is the reason?
Right. So one, no, you did not cause your child's autism. what research tells us really is that yes, there are indicating markers that will make autism more likely. So genetics, of course, being one of them. If you have a child with autism, and then having a sibling with a child with having a sibling also with autism is perhaps very likely. Having chromosomal or other conditions like Fragile X or tuberous sclerosis again makes the likelihood of autism more. So those are some indicating markers that we've known that have, that will increase the likelihood of autism. But no, you did not cause autism. But so when you are going to, let's say, a developmental pediatrician who is a pediatrician who is experienced and is an expert in developmental disabilities, what you have to realize is that variability in milestones is expected in this age group. What the pediatrician is looking for is not just one particular behavior, not just delayed language, or not just how he's playing. They're not looking for just delays. They're looking for patterns of differences across different domains. So they're looking at differences in language, communication, play skills, interaction skills, behaviors, all of those skills combined. It's a behavioral diagnosis. There's no blood test, there's no MRI to diagnose that. It's a behavioral observation that the developmental pediatrician will do.
But ma'am, as a mother, I mean, if my child is not responding and I feel that he's mentally sick or mentally ill and I'm going to hide it, and I don't even know the name of the developmental pediatrician you mentioned. I just know my pediatrician. Are all pediatricians clever and clued into these developmental syndromes to catch it or to identify it? Because otherwise I would never take my child for curing at all. You just mentioned cure. I'm going to come back with that. But answer this question, please. Why would I take my child if I'm feeling, he's mentally ill? I would take him somewhere else then.
You're right. I mean, there is a great load of stigma, guilt, shame attached to getting a diagnosis. And of course, we have parents from all kinds of, walks of life, parents who will say that I see something that's not a fit in my child and I want to get the help that I want. And then there will be parents who don't have the family or the society support to be able to take that step. I think the important thing to keep in mind is the fact that we all sort of know at the back of our minds, but are maybe having a tough time taking that first step, is about early intervention. So there is enough research to tell us that, when we are able to diagnose something early, and it's not just related to autism, I think we can look at that for any fact of life. If we are able to diagnose something early and we are able to take the necessary steps, then of course the prognosis that we're looking at is much better. The likelihood of things improving faster is much better. So that is a known fact, that is a research proven fact as well. So I would really urge parents, I would urge the society, and I guess we'll talk about that as well towards the end. Just take the first step and go see a pediatrician. Most pediatricians should be able to identify some red flags, and we can talk about those red flags as well. And as a parent also, usually I think when parents come for a diagnosis, if you were to ask them, what do you think is going on? They will be able to point out some of the things that they're seeing that's a miss.
So the awareness of the parent, the courage of the parent to ask, and a frank conversation with the pediatrician would be the first step. Thank you for that. And I think we would definitely like to highlight the red flags that you already mentioned. Ma'am, but is it curable? Should I go with hope, or should I, be sad about it? Like my other child is normal, but this child is not so normal or abnormal, and I love him more for that. The love doesn't decrease, it just increases. But then I have a fear. Can I cure him? Can I help him? Every parent wants a child to be independent. What are the therapies? What is the treatment possible for every child? Is it the same or is it different?
Firstly, I think it's important for us to know that this journey of parents from identifying red flags at home to taking that first step to go to a doctor, finding information on your own in a country which is not very streamlined in these situations, is an extremely daunting, overwhelming, sort of difficult time for the parents. It's a real concern with so many therapies, so many opinions, so many doctors. Where do I go? How much can I do for my child? And am I doing enough for my child? So
That's well said. Absolutely, yeah.
Right. So there are so many approaches out there in terms of, there's ABA, there's occupational therapy, speech therapy, physical therapy, special ed, medications perhaps. So all of those are in the gamut that, you can choose depending on where you are in the city as well, in the country as well. Here's what we know from research and years of practice. There isn't one magic therapy that's going to work for every child. So that's the first thing that parents need to be aware of. What makes the biggest difference and the impact is when your approach and your support for your child is one evidence-based, which means the therapy that you're choosing is rooted in grounded in research that has happened. Two, it's individualized for functional skills for your child. So one, the goals that you're selecting for your child have to be catered to your child, and not only your child, but also your family preferences and priorities. Selecting a goal.
Customized to everybody's, absolutely customized, not standardized. Okay.
Absolutely. There is absolutely no cookie cutter approach. And the therapist can say that this goal is really important for you to do. But if the family is not on board, that goal is completely meaningless. That goal has to be something that makes an impact on not only the child, but also the family and the immediate caregivers. So it has to be individualized and functional for the child. And three is it has to be collaborative and consistent, which means that the caregivers, the school, the therapists, all of them have to be on the same board and be consistent with what you're teaching the child. You can't have different therapy styles and different content views that are confusing the child. So that's something that we have to take into account when evaluating services.
So it has to be a buy-in first from the family and not just the doctor or the patient. It's a completely, it's a cohesive and collaborative, as you said, which means all three people are involved in it. But suppose it doesn't work. Can I speak to the doctor? Should I protest that this didn't work? Or does it take time? I mean, I need to understand when I should, say, no, this is not working for my child.
Absolutely. So
how do I know that?
Absolutely. So I think the collaboration piece comes into play at that point. I think as a parent, you have to be your child's advocate first. So be comfortable asking those questions. Go with your parental instinct. If I'm a parent myself, if something doesn't feel right to me, I should be comfortable asking that question to the person who's in charge. If this goal doesn't feel right, talk to them about it. Why are you doing those goals? Why are we teaching this? How is it going to impact my child? How can I help my child? I think those questions and that open, transparent communication has to be first and foremost in that relationship of the therapist and the family. That's really, really important. You should be able to go back to your pediatrician or your developmental pediatrician for periodic developmental screening. So you know that the therapy and the efforts you're putting in is making an impact in his progress and development. So every 3 months or every 6 months, whatever your pediatrician has recommended to you, I would recommend that, yes, do your therapy on the side, keep working, but then go back and meet the developmental pediatrician so that because they have the history and they can see the prognosis and they can guide you better.
So your answer leads me to two questions in my mind. The one is the support group or the monitoring exercises for the child per se, and the other is the training or the support for the parents or the family. So are there any support systems or trainings that a parent also can go through, to participate, to evaluate the whole exercise, or just push the child and keep pushing the child, or just remove it and stop? Because otherwise we'll just stop and move on, and what will happen to the child? What will be the consequences of not doing anything?
The consequence of not doing anything, I think, is a tough one. When we don't take care of something, that's going to perseverate and that's going to become difficult. And again, knowing what we know from early intervention and all the therapeutic approaches, we know that when you start working on something, the brain is malleable, the brain will learn. Learning can happen at any age, at any stage. So we have to sort of find a way to work with the child, given our own mental health in mind. We have to find opportunities to help the child meet his progress and meet his development. How can parents be participative in this journey? Again, to each parent, its own. There are days where parents may just sit back and relax and observe what's happening in therapy. And then there are days where the parents may be active participants in that therapy. So it really depends on taking one day at a time, do what's easy for you. I like to really keep it simple for the parents. And not sort of try and overwhelm them, because it can be anyways a very demanding, overwhelming and isolating journey for them. So I think what I try and recommend to parents is, one, when you're observing the therapy sessions going on, observe the therapist, learn the strategies that they're using, understand the goals that they're working on with their child, and then find simple routines in your daily life to embed those teaching opportunities. So if your child is working on play skills, or communication skills, or is learning to point towards something when he wants something, you can observe that and you can embed that in your daily living skills, like when you're, giving him a bath, or when you're dressing him, or a meal time, when you're sort of doing the chores of the house. You can really embed small teaching moments in those daily routines. You don't have to be the child's therapist. You don't have to sit with him and work with him for 30 minutes, 45 minutes, an hour. You can really find these multiple opportunities through the day, which are low effort, keep it easy for you and for your child as well. The second thing that I would say is, you as a parent know your child the best. So it is in your interest, and as well as the entire team's interest, to share those insights with the team. So if I know that this is something that the child will probably like to do or would not like to do, or this is a goal that they are struggling with at home, we will figure out as a team what a collaborative approach for that goal is going to be. Sometimes we get really good insights from parents, and it helps us in what we are trying to accomplish in the therapy. We also really get good we see the progress when we have parents in the clinic who are working with us, who will take home homework and do that and then report back to us that I tried this goal and it worked really well, and I can see how this will help him. And we immediately know, there are times where we know that, hey parent, did you work on this goal with him at home on the weekend? Because we can see that impact the next day. So it's really as simple as that, finding those opportunities and putting in a little bit of effort here and there in the natural routine, and to teach them. The last thing I would say to parents on getting involved in the therapeutic process with your child is something I think that's very underrated, not said enough, is take care of yourself. Your mental health is as important, if not more important, to fuel the progress of your child. So one day at a time, make sure you have time for yourself and you're able to get the help that you need, if you do need it, before you sort of take care of your child, because it will help both parties in that sense.
That's a very kind statement, because the burnout of parents is as important. Can you explain a little more about, you mentioned 3 therapies: speech therapy, occupational therapy, and something I read about, you're doing something called ABA. I don't know what that is. Ma'am, Can you explain all these 3 things to us?
Of course. So, speech therapy, occupational therapy, I think are more commonly known. So, they work with, the speech therapist will work with speech and language communication issues, and the occupational therapist or physical therapist will work with more gross motor related issues. And of course, I'm not an expert in that, so I'll leave that to those experts to talk about that. But I can speak about ABA because that's what I do. ABA, or applied behavior analysis, simply is the science of learning, understanding behavior. It really just tries to understand how we all learn. So if you think about how you learn, what motivates you, why do you do something that you enjoy, why do you not do something you don't enjoy? It just takes those learning principles and it applies them to a variety of different goals when it comes to working with learners with developmental needs. So it breaks down skills into small sub-skills and teaches them very, very systematically, making sure that the goals are, one, functional, that means they impact quality of life, and they're individualized. So they're developmentally appropriate goals for a learner. So I'm teaching goals that are functional for that learner. There is a heavy emphasis on generalization of skills, which is a huge aspect, which I think is an underrated aspect, where the child can learn everything in the therapy setup, but you don't see any transference of skill outside of the therapy setup. So the generalization of skills is extremely important in this aspect. So whatever the child is learning with me in the therapy session, he has to be able to demonstrate that in the natural context of when that skill is essentially happening. Collaboration with parents, again, a very important aspect, at least of our working style, where we have a completely, like in the clinic, we have a completely open door policy. Parents should come in, ask questions, get to know your child's program, get to know your child's therapist, and collaborate actively with that. So that's typically what really ABA does. The goal is not to change the child or change the personality of the child in any way, but it's really to give them the tools that support him in terms of having functional life skills and to be able to thrive in everyday situations.
Ma'am, you mentioned this word repeatedly, goals. I saw it in every answer. Do you have a definition or a clarity? What you mean? Do I brush my teeth, or do I change my clothes myself? Is that a goal? Do I bathe myself, or do I take a walk across the road properly, or do I get high marks in mathematics? What is the definition of these goals?
Yeah,
Be individualized, but they must be there somewhere in your mind because you speak about it.
Absolutely. So that's a great question. So again, so coming back to the individualization that we talked about, there is no cookie cutter approach. So I can have a 1-year-old or a 2-year-old or a 3-year-old. The goals will be developmentally appropriate. That means what is age appropriate for that child to be doing at this point,
Okay.
right? So that is what I want to focus on. And unless you have a solid, robust assessment tool that guides your implementation of those goals, you're going to be sort of scrambling in, let me do this goal
All over
like
the place and no correct.
for most children with autism that come to us, they have primarily language and communication is their main priority at that point, because a lot of them come in with either limited speech and communication or zero speech and communication. Some of them are completely non-vocal. So how do we work on improving those communication skills? Because we know from research and from logic that if you have decent communication skills, your frustration in life will go down. Like a lot of the children with autism have a lot of behaviors that are challenging for parents. There may be aggression, there may be destruction of property, there may be hitting, and there may be things like that. But a lot of them stem from the fact that they are not able to expressively communicate what they want, and that of course is frustrating.
Yes.
So our intervention typically will begin with a comprehensive assessment to understand where does the child stand on that developmental milestone ladder, to understand what goals do we work on. That's one. The second thing we have to realize is for especially young children, a lot of these goals are bound together. So when you're working on language, I just cannot have a child sitting and repeating words after me, which are completely meaningless and non-functional. I have to rope in and weave in play into that, because we know play is a prerequisite for language. So for a child who has, let's say, very limited language skills, may not be vocal right now, that's okay. I will still find other skills to work on through play. I can work on behaviors, I can work on flexibility, I can work on non-vocal behaviors like gestures, pointing, facial expressions, turn taking, joint attention, all of those skills. And of course, these skills and goals have to be relevant to the age that the child is. So
it's age appropriate and function appropriate.
Absolutely. So if I have let's say a 4-year-old who, should, let's say a 4-year-old or a 6-year-old who should be in, let's say, a specific grade in school, am I going to worry about teaching him academics at this point? Or am I going to worry about the fact that he has no communication modality? What is going to be my priority at this point? Am I interested in teaching him sight words, or am I interested in teaching him to ask for water when he needs water? So it depends on what is developmentally appropriate for that child. And it should stem from a solid comprehensive assessment that's done at the start of your intervention.
We also hear that some of them are really brilliant. I mean, maybe it's glorified, but they may be socially awkward, but in their particular technical skills, they're very brilliant. How do you nurture such children? Do they go to special schools, or do they go to normal schools, so quote unquote normal or ordinary schools? How do I select school?
Got it. So I think two points there. One, the savant syndrome that we hear about, right? The people with autism who are exceptional in certain areas. I think it's very romanticized, in through the movies and through we hear Rain Man and things like that. We have to realize that that's an extremely, extremely small percentage of the diagnosis. So we have to keep in mind. I think some numbers may be important over here, just in terms of the prevalence of it, and then I'll come to the next part of the question. So we have to know that, so April 25, US came out with their prevalence studies. The autism numbers are 1 in every 31 children, which is an exceptionally high number.
Very high.
It's very, very high. Boys are 3.5 to 4 times more likely to have autism compared to girls. The other thing to keep in mind is about 40 to 50% of the children or individuals who are diagnosed with autism potentially will be non-vocal. That means they will not have good language or limited language skills.
That's what I wanted to know.
That is what you're looking at. That is the significance of the diagnosis. So we have inclusive schools, which means that all children with different needs study under one roof. However, in practice, I think the schools may not have the training or the resources or the staff support, even the mindset for that matter, to sort of genuinely support neurodiverse learners.
Right.
Have special ed schools, which is better individualized care, individualized goals for them, individual attention for them. But at the same time, it doesn't expose our neurodiverse learners to neurotypicals, which again is an important
bullying. That's bullying in school. There's a lot of bullying that they go through.
Absolutely, absolutely. Schools can be more supportive. They, I think, have now started offering shadows to accompany the child into schools, so the child can continue to be part of a regular mainstream school setup while the parents continue therapy outside of school. I think the important thing really is to find your niche, to find for the family to find your a school that's safe, that's supportive, that
Very,
encourages the child to sort of progress, not just in academics, but in functional skills that the child may find valuable at that time.
that sounds good. Anything for the community can do, anything that the government should do in this, according to you?
Yeah, absolutely. I
By
think,
myself, I need help. Yeah.
yes. So I think, again, I like to keep it simple from, the parents, the family perspective or the community perspective. You don't need a child with a disability or a disorder or a diagnosis in your family to understand what another family is going through. I think simple, being tolerant and being sensitive really matters at the end of the day. Like
Empathy
simple,
matters. Yes, yes. Yeah.
like simple things like don't stare at a child who is having a tough time or is behaving differently or looks differently. Or, you may see a mother who's trying to manage a meltdown. Don't stand and stare at them and offer unwanted advice. Don't ask insensitive questions. I can't tell you how many parents will come and tell me that, the kind of questions they get asked in public transport or, when they're waiting in line at a grocery store. Just don't judge. It's just simple kindness, acts of acceptance that will, hopefully create a supportive network rather than isolate that family. As a community too, like invite that kid for your birthday party. It's, just be more welcoming. It's okay to create safe spaces where diverse learners can come in, attend a music class or an art class or attend a movie screening together. I think those are really simple, low effort things that everyone can do, and it's, it should be done. The government,
Absolutely.
for sure, is taking a lot of effort. They have Rights for Persons with Disability Act. They have the UDID card, which offers concessions and tax benefits to learners with disabilities.
Disabilities. Okay, right.
All
I wanted to know whether there is a patient support group, as we call it, or a disease support group, or a parent support groups. So any names that our audiences can have, that will be nice.
I think they're all sort of informal parent-led groups. There's Action for Autism that's known very well in Delhi, led by a parent as well. There's Autism Seva Kendra in Bombay that helps families with individuals and adults with autism as well.
And this list with the audience, yes, we would like.
Right. So there's a lot of Facebook groups, a lot of Insta groups that are very, very valuable actually in terms of just getting parents together. So I think those are good starts, and the pediatrician in your area should hopefully be able to share some other things.
You've given us a lot of hope and a lot of advice and a lot of insights. Give us 3 tips as parents what we should do, and 3 tips for our children what they should do, because they will always listen to you.
First thing is get help as quickly as you can. It's okay if the goal that you had in mind is not what you're seeing. It's okay if that goal looks different, but celebrate small wins, celebrate small victories. A new word today, a dinner in a restaurant today, a transition without a meltdown. Those are small victories, but very, very valuable. Take your child everywhere, wherever you want to take that child. Find the courage or the support system to take your child to a restaurant, to a grocery store, to a movie, wherever you want to take him. The more you expand his environment and his sort of world, the better equipped he's going to be in the long run. Children with autism are known to have very fickle motivations. They don't sustain through long periods of time. They may have interests that are unique and different. So from our perspective, it's to find what motivates that child and then embed those teaching opportunities in that learning moment. I think if the child goes through a certified, well-established, ethically and clinically strong practice, you will see progress at whatever age. Of course, early intervention has its benefits, but at whatever age, 7, 8, 12, 24, there is no age limit to learning. So whenever you have a concern, talk about it and let the child get the help that he needs to progress and flourish in his life.
Thank you, Saloni. That was wonderful. So to all our viewers, to all our parents, I think the advice she's given is great. Watch out for the developmental milestones that every child has. Everybody is, I won't call it normal, treat them as ordinary, as you would treat any other child. Don't isolate or ostracize them by calling them special. That will make them unspecial. And report, be aware, be courageous enough to ask your doctor what, if anything, is wrong. And I think The key, as she said, is to early intervention leads to early cures. That happens in any disease, whether it's cancer, whether it's diabetes, or whether it's autism. And second is your participation is vital as much, if not more, than the therapist or the doctor. And your child depends on you. You know your child, you love your child. So widen the horizon, be confident. Life still goes on. All you need to do is make him functional, independent, and you'll reach there with your love and your care. Thank you for watching. Thank you, Dr. Saloni.
These doctor-patient conversations are brought to you by CAHO and Patients for Patient Safety Foundation. CAHO is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by CAHO, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.